Well, ladies and gentlemen, welcome to the OECD webinar on blockchain in the coronavirus, supporting responses and building resilience, most importantly. My name is Greg Medcraft, the Director of the OECD's Directorate for Financial and Enterprise Affairs, which is the home to the OECD's Blockchain Policy Centre. The centre was created in January last year as a reference point for governments worldwide to consider how blockchain and other decentralized ledger technologies impact public policy and vice versa, and how this technology, could shape the delivery of government priorities. And obviously it goes without saying that COVID-19 has left governments and businesses alike reeling and racing to adapt. The virus has clearly revealed fragilities in our existing economic and social systems and has called into question some of our basic assumptions about the way business and citizens and governments actually interact. But if there is a silver lining here, it's actually now we've got the opportunity to perhaps reassess the way we do things and address those fragilities. And emerging technologies like blockchain, I believe could have a role to play. Clearly, we don't see blockchain as a fix to every problem, and for the problems where it is useful, it's often part of a solution. And some of the issues we've seen arising from the crisis are exactly the kind of challenges that this technology is particularly well suited to help address. So to give a few examples, firstly, is the need for heightened visibility in supply chains, tracing and provenance of medical supplies, or secondly, securely sharing and authenticating population health and epidemiological data between range of public and private sector actors, or thirdly, balancing the need to trace citizens' movements in order to prevent the spread of the virus on one hand, and the need for privacy and guard against misuse of personal data on the other. So clearly, blockchain could factor into the discussion, both in terms of the immediate recovery from the crisis, but also longer-term building really greater resilience in public and private sector activities going forward. So we are really looking forward to, I am certainly looking forward to today to take stock of these opportunities to help our member governments and our stakeholders in business consider where this technology perhaps is going to be useful now and more importantly, in the period ahead, and where alternatives or hybrid solutions also exist. And finally, I want to mention that today's webinar is a special presentation of the OECD's Global Annual Blockchain Policy Forum. The leading forum for really we're dedicated to really blockchain's intersection with public policy. And while we normally hold this at our headquarters in Paris, the forum's third edition for 2020 will be held towards the end of the year in a virtual format, which will allow anyone from anywhere in the world to participate. And I invite you all to join. And further details are on the OECD's Blockchain Policy Centre website. So with that, let me now introduce our moderator for today's webinar, the head of the OECD Global Blockchain Policy Centre, Caroline Malcolm. Welcome, Caroline.
Thanks very much, Greg. Really glad to be here, and glad to have such a great audience, and really privileged to have three fantastic speakers to talk to you about this idea of what DLT and distributed ledger technology, which is of course blockchain is one type of DLT, and we'll use the terms interchangeably here, but really thinking about what does it have to add to some of the challenges that governments are facing in responding and building resilience in the face of the crisis. And what I think is really nice about the speakers that we have here today that I'll introduce in just a moment is that they have broad technological backgrounds, which means that they're really able to draw out, I think, why DLT in the particular use cases they're talking about. So what makes it special? Because as Greg says, we're not here just to kind of promote DLT, and it's not the solution for everything. But there are some use cases or some parts of use cases where we think it really does offer something special that's not possible through other technologies that have been available to date. But I think Greg has given a really good introduction to the Centre as a whole and the OECD's work, and this is really a little bit of a taster of what you'll see in the Blockchain Policy Forum later this year. So without further ado, I'd like to introduce our first speaker, Jessica Douglas. Jessica is IBM's Blockchain Services Leader for the UK and Ireland, and she's a highly respected member of the blockchain ecosystem. She's experienced in solving real problems in a variety of contexts, such as supply chain management and sustainability with the targeted deployment of blockchain. Prior to her current role, she worked in senior positions at IBM in digital strategy and data privacy, subjects that I know really close to our audience's heart, particularly in the context of DLT. So on that note, Jessica, I'm going to hand over to you and ask you to talk a little bit about what you and IBM have been doing in this space. Jessica, I think we've got you on mute, unfortunately, so I might ask you to just come off mute and we'll...
Hey, I'm sorry. I think I was muted by earlier on. I do apologize. Hello, everybody. It's a real honor to join you this afternoon. I was described as a digital strategist, and I'm grateful for the term, but really I'm a practical implementer of real life solutions. So you've got to do some strategizing first, and I hope that we'll have the opportunity to talk about some real practical examples now and also have a strategic conversation subsequently. So we're in real tough times, and if we flip to the next slide, what I really wanted to do was zoom out from this question of the application of DLT and consider not the tech, but what it means for all of us as leaders in the public sector and also of businesses that are right in the midst of this, and obviously as human beings. So as leaders, clearly there's a huge imperative around data and insight to a degree that we've never experienced it before. And I think what COVID-19 has shown us is just the limitations of some of the data, particularly that public policymakers have. My sister is a health economist working in the midst of the crisis, and it's been fascinating, on our brief digital chats at the weekend for her to debrief on just, how challenging it is not only to understand what data is available and use it sensibly and make the right assumptions, but also to ensure that the balance is being properly struck between data that informs and saves lives and manages our futures with the appropriate levels of data privacy. So this whole question of how do we get the data that we need to make the right decisions and do that in a manner which allows us to plan for multiple scenarios is absolutely critical. Second, there's clearly a massive shift to life online. This is a virtual experience in and of itself. And so therefore, the degree to which things will now be expected to be digital by default rather than digital native, I think is worthy of consideration as we think about how we build out platforms for the future. And then equally importantly, and Greg said it, Caroline said it, it's all about adaptability and resilience. There was a 2010 Harvard study, I think I have it referenced at the back of this presentation, but I'll bring it forward now, which looked at the way that companies in particular, 4,700 of them had responded to very significant recessions. And the conclusion was that those who cut costs, entrenched and, hoped that this too shall pass were the ones who did not succeed. So there's clearly a requirement to invest and grow out of this curve. And it's certainly the experience that I have as I'm talking to clients and across a number of industries and also public sector, a belief that this is a time to be adaptable and build for resilience for the future. Think global, act local is one of those expressions that is really easy to say and very hard to do. I think just to add to that now, we have to decide quickly. And the great thing is that we've seen right across the board, fast decisions being made. They're not always perfect, but they're often good enough. And also actions by government that we never expected to be able to see implemented, certainly in the digital space, have been implemented very, very quickly. So I think, harnessing that capability to think in that manner, particularly the speed, is going to be critical going forward. I would say this, wouldn't I? I'm from the tech industry and a business that grows out of digital and cloud. But it's absolutely an opportunity now to see blockchain, automation, AI as tools in a kit bag that can fundamentally support recovery. And then finally, and this is to all of us who are working, together to pull together, to bring us out of where we are now and into a better place. There is a fundamental leadership requirement here. So crisis is testing leadership to its very core, and it's not just about what we do and the decisions that we make at a kind of business or public policy level, but the way that we engage with our people and the way that we demonstrate our authenticity and decisiveness in this moment. So all that by way of setting a context in which I want to talk about and give some consideration to some of the very valid and specific ways that blockchain is providing a kernel of capability to drive some of the things that we need to get to. So if we could go to the next slide, please, Caroline. Okay, so I've tried to express this in terms of kind of three phases. And I'd say that right now we are in the survive and respond phase and possibly shifting slightly into the strive and revive phase. Sorry for the hackneyed terms, I'm happy to accept others, but just imagine that this is the first 3 months is this. So, and what I've done here is I've tried to articulate where IBM has been engaged in specific initiatives. I know that my fellow panelists will talk to you about other initiatives that are going on. So rather than give you a market view, I'm talking about the ones that we're touching at IBM. But this is clearly part of a whole. So one of the first areas of focus has been on supply chain. So for those of us who are involved, particularly in food supply and retail, and are aware of IBM Food Trust, that capability has now been unlocked and enabled so that data has been able to support choices around how organizations deploy food to the right locations. So an example is that we were able to combine supply chain data and provenance data using Watson AI to help a retailer very quickly set up a command center, which enabled them basically to repackage their products differently for the new situation. So for example, they were providing packaged food that was being deployed into city centers for people to buy for their lunch. And they had to very quickly consolidate those packages into multi-packs that could be sold in suburban locations. So that sounds like the kind of thing that's simple to do. It actually is pretty tricky for consumer products and retailers to work that collaboratively that quickly. And within a matter of weeks, they were able to take those signals, change the manufacturing process and redeploy. And fundamentally, the point here is that as we're making these fundamental shifts as required for resilience, where we have data already locked and loaded in a blockchain, we can make faster changes than we might have done in the past. So we've also, and this is a particular one I think that Caroline asked me to mention, in IBM, we've repurposed a blockchain capability that we already had enabled, called Trust Your Supplier, into a capability called Rapid Supplier to Connect, which is designed to create a much faster ability to connect buyers and sellers of healthcare equipment, particularly PPE and ventilators and all that equipment that's being built by new suppliers. How do you validate that those suppliers are indeed safe to buy from and will not be providing you with fraudulent products? So I'll talk about that a little bit more in a moment. So we've seen a lot in provenance for sure, and in the identity and security around businesses being able to interact successfully that haven't worked together in the past. We've also seen a lot around data, trusted data to improve decisioning. So an example of this is MiPasa, which is a HEROX initiative with IBM blockchain and cloud, which basically brings together data for the purposes of healthcare modeling and is able through the blockchain not only to consolidate that data in a distributed manner, which all those data sharing trust, but also to audit and understand how the data has been brought together, again, to reassure and give visibility around the appropriate privacy and security measures, and also as well with the application of AI, ensure that that data is reconciled to a degree that you can get much better trend data across a huge data samples. So those kinds of very practical examples of what's been happening in the last 3 months to support requirements of the first phase show that blockchain, I think, can provide a very useful addition to an arsenal of capabilities to which Greg referred in the introduction. So we just go very briefly to the next slide, please, Caroline. So this basically just describes the buyers and sellers and the challenge around Rapid Supply Connect. I think I've given this enough time, given how much time I have altogether, Caroline. So if you can flip to the next one. Right. So we're kind of now moving into an interesting phase. And, you know, I must say that I must very humbly say that this is based on my own experience of the clients that I'm talking to and the clients that my colleagues are talking to. So it's that lens. But we see now a lot of focus on supply chain resilience. So we have in a number of different jurisdictions, combinations of industry and government, particularly around food and healthcare, approaching us, engaging with us on how do we build the resilience that we need for the future. So not how do we make the quick decisions now, but how do we create an ability to enable localized management of data in typical situation, but unlock that kind of the level that goes to regional and to national and be able to drive that strategic view in a way that we haven't needed to in the past. And that's another capability that blockchain really can enable, because one of the great things about, you know, private permission blockchain is it is exactly that, permissioned. So it's possible to create a set of data that's metadata and then unlock real data in an emergency when it's required. Now, generally, that's been incredibly patchy through the first phase because, frankly, there haven't been enough blockchain networks and equivalents connected in the way that, you know, from 2 to 3 years from now will seem normal and ubiquitous. But I think the promise of that is now in the sights of industry and public sector. So I think we'll see a lot more initiatives, particularly around the food supply chain and healthcare in the immediate instance. So the other areas, obviously, of relevance to this audience, clearly, you know, international trade and the stimulation of that in the context of a recession is fundamental. And I think that we'll see a lot more pulling on the levers that have already been created in blockchain platforms to enable and support that. So, for example, we.trade, which is a trade finance capability that has dramatically reduced the cost of trade finance, enabling the banks that provide it, a network of 70 around the world, to provide much cheaper trade finance to small and medium-sized enterprise, has a part to play in stimulating local economies, but also trade. And equivalently, Trade Lens, which is a shipping platform enabled by blockchain, but is effectively improving the process of through customs and digitizing the bill of lading, is absolutely the kind of blockchain that you can see being used much more dramatically in the future to understand where goods are, how to plan ahead, how to kind of deal with, for example, some of the stresses we saw on the port of Mombasa and the hold up to tea, which is very dear to the hearts of those who live in my country, as you know. So with that in mind, then we're expecting, and we're certainly having a lot of discussions right now about how do these sorts of capabilities enable international trade going forward, especially with all the various other considerations around international trade that we know about. And then I think the two other areas that I touch on, huge focus right now on transformation to net zero. So, you know, there are already blockchain platforms built and at scale to drive capabilities around transformation to net zero. And it is striking to me how many clients are equating, I think there's a cat may just be about to walk across the screen. I have my cat arriving through the window, so apologies if it does. Nope, she's going over there. Oh, there she is. Right, so the point here being that it is now possible to track and understand how farmers are being paid for their coffee. It's possible to use the blockchain to balance the grid and upload electrical power from the batteries of electric cars up into the main grid. And that's what we've been doing with Tenet and a number of the other energy firms across Europe very recently. And also plastic free, we've been enabling a platform which provides certification of plastic free consumer products, packaging, as well as products. And that again, certified on the blockchain, trusted and enabled for consumers as well as for businesses. So we're starting to have the building blocks to enable fundamental transformations for the resilience and sustainability, because I think pretty much everybody would agree that resilience isn't just resilience against further waves of COVID, it's actually overall planetary resilience in the next 10 to 15 years. And finally, and I'll touch on this very briefly, a lot of engagement around digital currency payments and exchanges. You know, this has been a place of experimentation for a good long while. Indeed, it was the first area to look at blockchain seriously. But we're seeing central banks and major banking institutions engage in a much more real way in this space. And I think we'll see that not only from the point of view of running the economy going forward from the point of view of banking and trading, but also in terms of enabling some of the stimuli that are going to be required to reflate the economy. Can we move on, please?
Sure, Jessica, I'm just going to interrupt you. Just I'm conscious of the time for Frank and Riho. So perhaps just if you had about another 30 seconds.
I can do that, yeah. If you take me to the two slides on. Okay, so we'll go to the next one. Right, so I just want to really leave you with a couple of thoughts here. So Justin Trudeau said the pace of change has never been this fast, yet it will never be this slow again. I think it's been extraordinary. For me, the thing that's been most extraordinary about this period has been how fast things have happened. You know, HMRC, the tax authority in the UK, put in 2 new tax schemes digitally in less than 6 weeks. And who would have thought that? And, you know, and Helgoria, and apologies, I haven't got the accent on the I correctly here, you know, talked about win-win policies for people, planet and prosperity. You know, this is what policymakers need to be thinking about. And those are really challenging questions. Heartening, I mentioned the HBR review in 2010, that spending sensibly on stimuli that spending and investing in recession is far more likely to get private businesses out of recessions in a successful position. But also Oxford Economic Review paper this month saying that green stimuli can repair global economy and climate much more efficiently and effectively, indeed, you know, twice as effectively per dollar than traditional stimuli. Is food for thought as we consider blockchain. If we go to the very last slide now. Okay, sorry, go up. And go, take me to the one that's 1, 2, 3, 4, 5, 6, 7. I think it's a build, that's the problem. Okay, so do we just leave it like that? Oh, can you just go to the not presented one? Okay, because it's not, okay, just build it up and I'll talk it very quickly. Okay, so lessons from this then, I think. I was asked by Caroline to touch on this. So blockchain platforms are real and being deployed to address real world challenges right now. You know, IBM is running 100 live scaled platforms today. And, you know, I can only imagine how many others there are. Second of all, the benefits of trust, privacy, security, provenance, traceability, distributed collaboration are not only needed now, but are much more proven than they were. And the third thing I think is that this notion of the network of networks, the ability to conjoin these networks and use the data differently to get to good outcomes, you know, will become pervasive and actually quite boring going forward. But the point about that is for policymakers, 4, 5, 6, and 7 are, you know, you've proven you can be agile and change things fast. So now use that momentum to start building. You know, think about platforms in terms of policy, build them, join them, but in particular, mandate them to industry, because it makes it much easier to build a business case if you've got a regulatory requirement. You know, all my clients tell me that it's far easier. So, you know, help the industry along by doing that. And then I think finally, these things are obvious, but must be stated every time. Openness must be a core principle of all these networks. So if you see closed systems where, you know, the code is not accessible, you know, be cautious, be wary. And then finally, I think insist on interoperability. And that's the point about network of networks. So thank you very much. Apologies, I've slightly overrun. It's a massive topic. And let me hand over to Frank.
No, not a problem, Jessica. That was fantastic. And certainly, I mean, some of the things you've mentioned there pick up on some of the work we've published here at the OECD. And I hope we'll get a chance to come back to that towards the end. But I don't want to hesitate before giving the floor to Riho. And while he's bringing his presentation up on the screen, just a quick introduction to Riho. And this is really fascinating because Riho is going to be talking about, amongst other things, some work that builds on really what was, you know, in terms of at the government level, one of the first moving governments in the blockchain space, of course, Estonia, and really talking about, you know, how that kind of platform has provided opportunities for new applications in the face of this crisis. But Riho himself is an engineer by nature. He likes to build things and solve different problems. He's been creating IT solutions for 16 years now, everything from simple web pages to telecom self-services. He's worked for corporations and startups, and his latest projects have been involved, including coronavirus tracing app for Estonia, data registry of Estonian social services and benefits, fraud detection on Bitcoin trading, IoT billing platform, and freelance-based marketing platforms. So really well placed, Riho, to kind of give us a different perspective from a different background and also, you know, a different country experience. So over to you, Riho.
Yeah, the mute button changed when I started sharing. Yeah, thank you for the introduction. My name is Riho, as mentioned. I'm from Estonia. I'm also from this software development company called Igloo. Today, I'm really proud also to be a part of this consortium of other Estonian software development companies and public sector. We have come together to build this corona tracing app. So why are we here today? We're here to kind of listen about new technologies best practices. And I imagine a lot of high-end decision makers are here today who kind of already know, have heard a lot about blockchain and distributed architecture, but might be a bit afraid to jump on board. And because frankly, I haven't seen ever any high-end decision maker who jumps from joy when he hears about new technologies. So my goal today is kind of show you how we do things in Estonia, and actually that distributed architecture and blockchain are not that new of a technologies that one might think of. So coming back to the app that we are developing, I'm going to go over how we solve this problem of creating the app in Estonian's environment, where what we have placed before and how we can use it. So building the app itself, it's actually really simple because Google, Apple, TP3T from Switzerland have done a lot of work. They publicly give the code to everyone to use. So basically, everyone can take it, redesign, give a nice UI, and deploy it. The only hard part for each nation is to how you're going to do this infection confirmation part. Why we want to do this is that you don't want people going around marking themselves infected on an application that, I don't know, people do it for fun, for trying to cause some panic, whatever. We don't want these kind of things happening. So we need to keep the application anonymous while we really need to get the information from the healthcare data to be sure who notifies themselves as being infected. So how we solve this problem? To understand this, we first might want to know, like, where does this data come from? In Estonia, most of the countries probably, the initial data comes from the laboratories who create those COVID-19 tests. And they, once the test results come, whether it's positive, negative, they insert this data directly to the healthcare system, which will be the absolute source of truth for this person, because every doctor, every hospital will access this data from this central healthcare system. Of course, this system has so critical private data that we don't want to have any connection directly from our app to this healthcare system. No lawyer in Estonia would allow that, because, yeah, we don't want to do that. We want to keep the application tracking contacts anonymously, but we want to use the data from the healthcare system to allow a person to mark themselves infected. How do we do that? Actually, that's, again, pretty simple in Estonia, because thanks to some really smart people 20 years ago, Estonia has chosen a decentralized architecture for the whole nation. So here you can kind of see a nice picture of this system. You can see the different registries from public and private sector to joining this network that is joined by this data transaction layer called the X-Road. This picture kind of shows the overall kind of vision. Different companies can join this X-Road and apply to be a part of this X-Road and gain access on company level. You can provide access, provide information to this network, and you can apply to get some information from this network. A lot of people right now might be thinking, like, this doesn't seem anything like decentralized system. And the Internet X road seems like one big single point of failure here. I got this picture from Taavi Kotka, who is a former CIO of Estonia, and he has always joked that he made this picture for politicians, because actually X-Road doesn't look anything like this. Real X-Road looks like this. So the X-Road actually is not a data transformation transaction layer. It's more like a standard. This X-Road provides peer-to-peer connection from every registry endpoint to any other one. It also provides security, and it also validates the data integrity and authenticity through blockchain. So it's really important to note that we here in Estonia, we don't keep data like the databases data in the blockchain, but we validate and validate the data authenticity on the blockchain. So that's how we do it here. Yeah. So basically, this coming back to the application, we need to access one of those green dots, which is the central healthcare system. And how can we do that? From the application, when the user presses the button to inform that I am infected, first of all, a secret key will be transmitted to the database. But also another action is that we take the user to an endpoint or web page called Patiendiportal. This endpoint actually already is familiar to the Estonian people, and this endpoint has access to X-Road, which means it has access to also the healthcare system. So right when we direct the person to this endpoint, we ask the person to hard authenticate himself or herself. One can do it with the ID card, mobile ID, smart ID, or whatever hard authentication method. And right after he has done it, automatically, we will query the central healthcare base on his or her name. Like, do I have a COVID-19 diagnosis? Let's say in this case, a positive response comes, and another approval is sent to the database. So our application never has any private data of this user. The Patiendiportal never has any secret keys that anyone can trace from the application. And everything's fast and secure and decentralized. Also note that we never duplicated any data. We validated against the absolute source of truth, the same place where CDC workers get their data to start informing COVID patients. So we actually, in this way, the user could actually mark themselves infected before the CDC worker even has the time to call them. There is some possible ways that they can actually know it before, if they go check. Yep, and that's it. So my thought I would like to leave you is this, that building big information systems is extremely hard. Building extremely big information systems is relatively easy. You just have to focus on the data exchange layer, make it secure, and focus on the authenticity of the data and let other people create the great network. On this government level, by other people, I mean ministries and companies. If we're talking on a corporation level, then product teams, development teams. On the central part, focus on the communication, make it secure, let everyone else do what they do best, build great systems. Thank you.
Thanks very much, Riho. That was great. I particularly appreciated how you simplified it all for us non-engineers to explain that what we're actually shown in terms of the Estonian system, really hides what's actually going on behind. But I think it's a really, really useful example, and of, I guess, the unique opportunity that these distributed systems offer us in terms of having having something like a contact tracing app, but which also preserves privacy as a paramount as a paramount factor in their development. So I thank you very much for sharing that experience. And I now want to hand over to Frank. Some of you might be familiar with Frank from our 2019 and 2018 Global Blockchain Policy Forum. Frank is the CEO and co-founder of a company called BurstIQ, which is a health-focused global network that connects businesses and people through the power of blockchain. So the company's big data blockchain platform enables true individual ownership and control of health data, sovereign identity services, granular permission-based data sharing, and multi-dimensional regulatory governance frameworks. There's a huge amount of work, and I know that Frank is going to explain to us very well what they all actually mean in this context. He's been working on some really exciting things, both at Burst and in some other consortia. So Frank, without further words from me, over to you.
Thanks, Carolyn. And Riho, love the last quote, because that's what we decided to focus on when we started the company in 2015 was, how do we make data more usable and more personable, particularly within the health space? And I think we can all agree that we experienced a pretty transformational shift in our understanding of health. I'm going to start out just with a few comments, and I'll pop up a few slides. In our understanding of health, it really started prior to the coronavirus pandemic, but I think the pandemic itself has forced us to look at life from a much different perspective. The reality is our health just isn't about protecting ourselves, our loved ones, and society from a virus. It's more really a reflection of our own personal stories, our social or behavioral, environmental, education, financial, spiritual, and of course, our omics and how we're living our lives all kind of wrap up into this whole thing we call health. And we, I think, are quickly now being several months into dealing with this pandemic on a global scale, are coming to a common understanding that sacrificing a lot of aspects of our health in the short run may be necessary, and definitely has been necessary for the common good. But we also understand we can't sacrifice them, all these aspects for an extended period and not experience severe and long-term ramifications. So, I'm gonna just read off a few things that we're just beginning to understand in terms of the ramifications and impact of the virus and some of the policy and response. So one, and I think this is the biggest one for me in many ways, is we've seen a drastic increase in mental health from multi-dimensions. So more prescriptions of medications. In some jurisdictions, we've seen a rate of suicide equivalent of 1 year equivalents occur in 1 month. Stroke evaluations down 40%, and some of these are U.S. based, but they extend. What I found with health and health data, they extend pretty universal across many jurisdictions. Half of the cancer patients miss treatments because they're afraid to go to the hospitals. 75% missed potential cancer patients miss screenings. 85% fewer living donor transplants. Missing up to half of childhood vaccines. And not to mention that I think just some of the economic impacts and stress has also increased the mortality rate, particularly more in a younger demographic and population. And then here's one that a lot of people don't talk about right now, is that we were so concerned about the about the capacity of our health systems around the world dealing with those who are suffering from COVID-19. That we stopped a lot of elective procedures and other treatments to the point and again, this is not single payer systems. This is in some commercial or self-sustaining systems. We're seeing actually layoffs of health professionals. So to include nurses, the exact professionals we need to kind of deal with aspects of the pandemic. When we take a step back, what we can say is that COVID brought one thing into focus, and that is how connected we really are across the planet. In many ways, we didn't anticipate or understand from a broader population. From the aspect of a crisis in one part of the world turns into a global crisis. And I still think, there's going to be a lot of good out of this. So goods in parts of the world are going to spread. And one of those goods are good things that are coming out of this is how people looking at things that we're doing as a community, as a blockchain community, and how it can address some of these problems from a much different perspective in a way that helps deal with this insatiable appetite now for data and understanding how all this connectedness impacts everything. But one thing it's also demonstrated is how much is still a mystery and where all the gaps were, particularly in the research community. But this data about us as individuals, our interactions with each other, how connections impact health, has all become a very valuable commodity on multi levels, and in fact has a huge potential for misuse if we're not careful, as Greg pointed out. So what we've really been challenged to do now is we really have to, as an industry and as a community, both in these the public side and the private side, which from one aspect has been incredible in the public-private partnerships. But we have to create this world about data truly being connected and accessible, but still protect individual rights and privacy, and design initiatives and incentives where it's really common in line, where we're dealing with public health issues and personal health issues in a good balance. COVID didn't really change any of this. These are fundamental issues that were really emergent, particularly with all the emergence of precision medicine. But what it did was accelerated the need for and the need for us to really solve and address these challenges. So to me, that's the bigger picture. And I'm gonna share a few slides now. As soon as just to demonstrate a little bit what I think we've been seeing from our perspective. So, at our core, again, we're a data-centric platform. So we focus on creating mutable profiles of people, places, and things, and facilitating the transactions and interactions between them. So we started out by really using our technology as an enterprise enablement tool. It quickly has evolved into a kind of a broader network of innovators and researchers and public and private sector. And what we started to see back in 3 months ago, when we started looking at what we could do, we focused on really supporting kind of a global research and innovation network. I'll come back to that a little more in detail. But what also has emerged is opportunities around some of the work we were doing in distributed identity, which I think is fundamental to the notion of immunity and health passes and contact mapping. At its core, what is a health record? The health record are attestations to somebody's identity, and you really have multi-owners of that kind of data that Riho pointed out. And how do you manage that? And how do you share that in a positive way to deal with COVID? And maybe again to reopen our economies is still protecting public health. We've seen an explosion in telehealth and telemedicine, and in particularly how we can facilitate doctors to be more productive in these type of encounters by making information accessible at the point of time of encounter, and that's information about you, kind of that longitudinal view of you, both hardcore clinical information, but also softer type data to make good diagnosis. And of course, we've seen a lot of things on the supply chain side of life, but at the core is really this notion of data sharing. And we've had a fundamental belief over the years that the research community had a big gap, and that is they don't like to work together in many respects. And there's some collaboration, but there's still this really set of walled gardens around, I need to protect my intellectual property, I can't overly share, I have to deal with privacy issues and a whole other jurisdictional regulatory pushes on how you develop new medications and treatments. And we wanted to expose the community and really help facilitate the community in terms of adopting some of our new technologies. And of course, when we're dealing with research, you have all these participants within the network. I'm not going to spend a lot of time talking about them. I think you can see it. You know, what's been very heartening is that the regulators have really saw how in some areas where things were actually blocking innovation and movement, and definitely we've seen a tremendous response from the private sector, both from large companies down to small companies, and trying to work together to really deal with the problem. So in one respect, you see a definite willingness, but then in terms of wanting to do it, then the question is how, in a way that still balances things out. So we launched an initiative called Research Foundry with the support of global researchers, public health officials, organizations, and actually a really nice network of innovators that really believe in this whole thing of this whole aspect of problems can only be solved collaborative in a way to connect them, to sponsor initiatives and build and test solutions. Now we did it in a way that that again, we want to support this distributed research, and I want to talk about it. This is what I want to talk about a little more, just so we have a little more time for questions. We did it as a free utility service, and really with the goal, when you look at blockchain frameworks and architectures, and even philosophy, we wanted it to grow and run on its own without it being a company. You know, the internet grew up with a winner-take-most model. We don't think that works here, particularly in the health sector. You know, there's not, you know, there isn't going to be a health Facebook. You know, there's going to be a collaborative effort. Data's at the core in our view, and again, I'm going to reemphasize. But we wanted access for anyone. We want it to be secure and audible, interdisciplinary, accelerate development, and no cost for participants. I think that was key. And we also established a separate governance. So again, we wanted to really stand on its own, not as a company asset, but as a researcher asset. And so we opened up a number of ways for people to participate. We populated the environment with 100+ data sets, some just pure health related, some COVID. We've been scouring all the open data sets at one level to make them freely available. We have a list of well over 1,000, and I tell you, many of them aren't worth even looking at. So you want to curate the data sets and make them accessible and usable, not just downloadable. So, you know, we have a number of folks proposing projects on the platform, developing applications, you know, from around the world, some contract tracing, some pandemic management solutions. We open up data sets for access and to be analyzed, again, both, and we allow people to publish data sets and even create private collaborations and share them with specific individuals or groups amongst themselves. And of course, what has also been heartening is that we've had this growing list of data scientists and researchers saying, hey, I'll volunteer and I'll support projects, and I'll do it pro bono for free if I can help push a solution forward. So again, at its core, within the framework is really at the basis DLT, but then, you know, we have a way to really manage and secure data assets and overlay a really multi-dimensional set of smart contracts Again, we're trying to put the power back into the data owner's hands, even if there's more than one data owner. So there are a couple of other features, in terms of what happens in communities. I'm a big fan that blockchains themselves are just networks, which create connections, which then create communities and drive markets and change. And that's what we're trying to facilitate, really driving it initially from the research side of life. And I want to hit just a couple of samples. So we teamed with HEROX to support what they call COVID-19 Central. If you go to that website, you're going to see probably 40 innovation initiatives listed, and I know there's a lot more around the world. So we're providing a set of resources to support a lot of these innovation initiatives, in addition to what we're doing just directly on the platform with public organizations and our own innovation community. The other one is something that we've been supporting with the American Heart Association, which is probably one of the world's most prestigious research organization for cardiovascular and brain health. And it's a pretty, from a data perspective, what's emerging is that there are social, economic, and cultural aspects of our population that are impacted a lot more with COVID than others. So what American Heart, in conjunction with Hitachi and using a platform and sponsored a data challenge, they actually underwrote the data challenge with some prizes. It's coupled with several $1 million of research grants that they previously released. And so we're pretty encouraged about these kinds of things really emerging up from the collaboration space. And there's a number of others that'll follow this. So it's really been a pretty positive thing. And what's really gotten a lot of organizations, both on the public and the private side, comfortable, is not just the word blockchain, but the fact, hey, you mean I can consent my data, I can still own my IP, but still share it and collaborate and publish and do all these really cool things in a way, in a trusted and safe environment where I have a little more control of what's happening. And so blockchain for us, from our perspective, it's an enabler, absolutely. And blockchain methods can be used in different ways in terms of how we secure and protect data in a way that keeps it relatively on chain or within side chains, and the consent models. All these things are enabling, but you still have to solve problems. And in the case of the research environment, it's how do you facilitate broader collaboration and still have a fundamental trust basis. And I think, and at the end of the day, you got to do it still from a compliant perspective. So everything on the network, we run pretty extensive audits against the network and try to be regulatory compliant with some of the overarching regulations in the US and outside the US, and specific regulatory guidance within countries in terms of how you can share and utilize personal health information without compromising the privacy of individuals. So that's it. So Research Foundry is off and going. It's been an awesome initiative, and has also, hopefully raised a lot of awareness in the blockchain space and its potential uses. So that's it for me.
Thanks very much, Frank. That was really helpful. And again, just something perhaps which people hadn't thought about in terms of an application of the technology. And I think it was very kind of helpful to give that concrete example. And also something which is already happening. We often talk about blockchain and DLT as if it's something that's going to come in the future, that it's not quite here yet. But really, I mean, what we're seeing is some very concrete projects which are being scaled, which are already in place today. And I think that's important to keep in mind, particularly for this audience of policymakers. I know we're running very close to time, so I just really wanted, I'm just going to put up on on the screen some contact details for us in case any of those of you watching on the live stream would like to get in touch with us or with any of the speakers that you've seen today. We will make this presentation available on our website, and you have the details there as well as our email address. We will have an opportunity for those who have joined us by Zoom to ask a few questions. But if you're with us on the live stream, I want to say thank you very much on behalf of the OECD's Global Blockchain Policy Centre for joining us. I hope you found today very, very interesting. Keep an eye out because we will be producing some more of these webinars in the lead up to this year's Global Blockchain Policy Forum. So thank you very much. And thank you, Elodie.